no one on our side of the aisle bumped Senator Grassley. So just for the record on that, let me add one other comment here. What Senator Grassley was talking about on the gypsy issues and the reimbursement for physicians. When Oklahoma is competing with New York City for rates and cardiologists, the devices cost the same no matter where you are. The costs of everything are the same. And so this process of punishing doctors if they practice in rural America or even in just not in the largest cities in America has got to be resolved in this long term. Shockingly to some folks outside this building, there are some areas that we can work together. Last week, Senator Durbin and I actually dropped a bill on Rural Hospital Closure Relief Act. It's the same bill that we actually had in the last session that we felt we were very close to dealing with. And this deals with the critical access hospital designation. The rural emergency designation doesn't work for every location. And we are trying to fix this 35-mile perimeter that we literally have hospitals in Oklahoma that are 34 and a half miles and trying to be able to work through the process and it become a pain on it. So there are areas where we're trying to work together practically to be able to resolve some of these in very practical ways on this. Oklahoma State University has had a process for a while of trying to attract people out of rural Oklahoma so that they would return to rural Oklahoma to be able to practice medicine. OU has been very aggressive in trying to be able to train physicians as well, nurses, other practitioners. So there is some practical work that's ongoing on this, but clearly we have a long way to go in several areas on this. I do want to talk about some of the workforce issues because this is a significant issue in attracting workforce into rural hospitals. Duncan Regional Hospital in my state has done a lot of work in partnering with local universities, even reaching into high schools, doing programs there, and then helping them through their education to be able to then return back to Duncan Regional on that. Have you seen success, and any of you can answer this, have you seen success like that in other areas? Because that's been very successful for Duncan Regional. Anyone else seen success in recruiting workforce long-term?
Yes, thank you for the question, Senator. I would say that partnering with universities, academic medical centers has helped us a great deal in providing greater access to healthcare in rural areas. We have a partnership with NYU Langone for general dentistry residents. We are working to establish another residency for pediatric dental care, and we are working with the University of Maryland School of Medicine to establish a rural training track for physicians in the area. I think what the challenge is that some of these initiatives that we've taken on, they take time. And you have to be proactive to plan and to get them into place. And I think right now in terms of workforce, we're in two stages. We're in reactive and proactive. And so how do we bring all those together so we can address these challenges?
Yeah, it takes a while to be able to raise it up. The federally qualified health centers in my state, we have a phenomenal group of leaders and groups that are doing it, almost 200 in my state, scattered around the state. They are the primary caretaker for a very large percentage of so many folks in our state, and it's been a very, very successful model now for several decades. So very grateful for them. They've raised the issue to me about 340B, and I know that's not in our committee, but for contract pharmacies. Are you dealing with the contract pharmacy issue, Mrs. Risch? The federally qualified health center and trying to be able to deal with that pricing model? Is that something you're dealing with right now?
Yes, many community health centers across the country are 340B participants, and it certainly is an important tool that we have to assist our patients and provide additional care in rural areas.
That's been a big issue on the pharmacy side of this as well. This has been one of my frustrations, and I know none of you are pharmacists in that sense, but you're interacting with those folks. In a lot of our rural settings, that local pharmacy in many areas is the only really healthcare professional that's in that area. I have a lot of concerns. Our committee's talked about this quite a bit. I'm going to continue to be able to raise the issue of the DIR fees, especially for our rural pharmacists and those independent pharmacists. Literally, PBMs are driving our rural pharmacies out of business for their benefit, but not to the benefit of healthcare advice for many of these folks in rural areas to be able to come to someone and just saying, hey, just mail order this and it's going to be fine. But that's not fine for a lot of folks that just need some counsel, that have multiple medications and need somebody to be able to talk to. Are any of y'all dealing with individual pharmacies and the DIR fees in particular?
One of the things that concerns us, particularly for rural healthcare, are white bagging, where as an example, chemotherapy is provided in a small community, but the insurance company makes sure that they get the medication from the insurance company rather than from the local care provider. What people don't understand is that some of the money that comes from getting that medication at that particular area pays for the care and the infusion center that the patient is getting, particularly in a rural area like Deer River, Minnesota. When that goes away and white bagging goes away, that site goes away because there's no way to fund the site.
Yeah. Mr. Chairman, I appreciate you holding this hearing and going through this incredibly important issue for us. I'd love to be able to spend some time, I'm out of time on this, but the issue about Medicare Advantage, we have quite a few Medicare Advantage carriers that are advertising to rural America to get Medicare Advantage. People are signing up for it and finding out that there aren't actually providers in their area, and they have to travel in very long distances. That's a different conversation for a different day, but that's definitely affecting rural America as well.